you, New Resource Bank, for having us in today to talk to you about an investment opportunity for Life Seed Diagnostics. We're bringing micromanufacturing of simple diagnostic tools to the developing world to empower local community healthcare workers to diagnose infectious diseases. There's a silent and ancient killer living amongst us. This killer is responsible for more deaths worldwide than all the other communicable diseases combined. That's tuberculosis. It's still with us, and it's still very deadly. Over 8 million people catch tuberculosis every year. Over 1 million people die from it. It's truly a global problem. The World Health Organization has identified these 22 countries as high-burden tuberculosis countries with a high prevalence of this disease. We're going to focus in on one country, this tiny little country over in the corner next to India, Bangladesh. It's the 6th most prevalent country in the world of tuberculosis. Every year, 70,000 people in Bangladesh die from tuberculosis. This is what 70,000 people look like.
And we can change that with microprint TV. Small piece of paper, about the size of a stamp. It's a point-of-care diagnostic test that delivers almost instant results when in contact with a human specimen, such as urine or saliva. It is easy to use and does not require sophisticated infrastructure to administer. And when done, it can be simply burned, thus creating no biohazard waste. This is a real technology that exists today. It's patented, developed, and tested by leading universities in the United States, and we're currently in negotiations for sub-licenses. The coolest part is that final cost of one test is under 50 cents, which we think is pretty neat. The best part, however, is the fact that these do not have to be manufactured in the US and shipped. Trained technician can simply print them on a standard solid ink printer with a wax cartridge, some reagents, and a heating plate. We call this process micromanufacturing, and it's at the core of our business model. That means that these tests can be printed right in the area where the need is, thus building local capacity and creating jobs. We, Life Seed Diagnostics, are going to bring the tools and know-how to make this happen in the developed world, starting with Bangladesh. So, what are we facing in terms of competition? Currently, there are multiple devices available on the market, starting with large diagnostic machines. This is something that probably processes your tests in the Western clinics. These machines are huge, extremely expensive, and really not suitable for local infrastructure. Then we have microscopy, which is a golden standard of testing for TB around the world, including Bangladesh. It requires less infrastructure, it does build local jobs, however, it requires going back to the lab, where in the country where one way to the hospital is hours by foot can be challenged. And finally, we have rapid diagnostic tests. You're probably familiar with the pregnancy stick. These are relatively cheap at about $3. They're easy to use, however, they're manufactured in the West and contain plastic, meaning they create biohazard waste, challenging for a country with no ways to dispose of it. This puts us ahead of the pack, both in terms of costs, ease of use, and local manufacturing.
Our disruptive technology, as well as our innovative micromanufacturing business model, are not our only competitive advantages. We truly understand our customers and the challenges that they're facing every day in Bangladesh. That is why we will empower local clinics and local healthcare organizations whose healthcare workers have to travel very far distances in order to reach their patients. We will make their jobs much easier. Our small and lightweight and cost-effective tests, they deliver results immediately. And that means that samples don't have to be brought back to a lab or to a clinic. And it will save hours and sometimes even days of strenuous travel for healthcare workers, but also for very sick patients. And in the end, that will save many lives. We identified credible customer partnerships, local organizations such as Bangladesh, Smile and Sun Clinics, and BRAC. We will help those organizations to put in place micromanufacturing facilities so that they can print their own tests and their healthcare worker network will distribute it. Those very well-respected organizations will provide us with feedback, especially in the beginning phase, which is really important to improve our service on and product offering on a continuous basis. And they will serve as brand ambassadors. And together we will scale our production and our distribution in order to increase social impact and also build our business, grow our business.
So our business model is based on selling starter kits to our customers. The starter kits will contain everything our customers need to set up a micromanufacturing facility in their hospitals. Not only we will provide the materials, but also set up a quality assurance infrastructure support and training. Not only for the technicians who will actually fabricate the tests, but for the healthcare workers who will then take them to the field and use them as well. Once the micromanufacturing facility is established, LifeSeed Diagnostics will continue to provide ongoing supply of the reagents and perform annual audits, retraining, provide ongoing maintenance support of our customers' operations. So the foundation of our revenue stream is the sale of the starter kits, as well as the associated training. As we move from the feasibility to the launch phase to then the growth phase, we, as you can see from our graphs, the supply resale will become more prevalent in our revenue stream as it should be, and will become important for our business operation. So looking at our net income, our break-even year is year 2. However, our growth in net income in year 2 and year 3 is quite limited because we made a conscious decision to, in those 2 years for quality assurance reasons, to keep the assembly of the starter kits in the US, in our US facility, while at the same time investing capital in building our own infrastructure and creating our facility in Bangladesh. In year 4, we will be moving the assembly of our micromanufacturing starter kits to our Bangladesh facility, which will lower our cost. It will create more jobs connected to our venture, as well as allow us to grow our profit in years 4 and 5. So, as Annika already mentioned, we are in communications with 2 customer networks. Smiling Sun Clinics, which is an organization of 327 clinics supported by more than 6,000 community healthcare workers. It makes it the largest private healthcare organization in Bangladesh, serving every year more than 20 million patients. At the same time, the second organization that we've been talking to is BRAC, which is a national NGO with more than 100,000 community healthcare workers serving primarily rural areas of Bangladesh. With $500,000 of startup capital, which we have $200,000 from the founders, as well as, that's why we are here, we are looking for $300,000 loan. We will start with 20 clinics in year 1 and then grow to a network of 600 clinics strong in year 5.
So we are LifeSeed Diagnostics. We are a diverse, multicultural team with extensive experience in healthcare, international business and marketing, technology, product development, and finance. We're currently in communication with a number of internationally recognized and internationally respected research and nonprofit organizations working in healthcare. So, tuberculosis is a curable disease, and it can be eradicated, but diagnosis is the first step to getting it. So, we'd like you to join us in enabling these local communities to build micro-manufacturing enterprises to put the diagnosis of tuberculosis where it's needed the most.